Hello and welcome to our channel. Today, we'll be discussing a common issue that many people experience: a pinched nerve in the neck causing arm or rhomboid pain. If you're suffering from this, you know how debilitating it can be. But don't worry, we've got some tips and tricks to help relieve the pain and get you back to feeling your best. So, let's get started. Step 1. Identify the problem. The first step to fixing a pinched nerve is to identify the problem. In most cases, pinched nerves in the neck are caused by poor posture, repetitive motion, or an injury. Common symptoms of a pinched nerve include arm pain, numbness or tingling in the arm, or even weakness in the arm or hand. Step 2. Stretching. Stretching can help relieve the tension and pressure on the pinched nerve. Start by stretching your neck and shoulders to release any tightness. You can also try specific stretches for your arm and shoulder muscles. Step 3. Heat or ice therapy. Heat or ice therapy can help relieve inflammation and pain associated with a pinched nerve. Apply a hot or cold compress to the affected area for 15 to 20 minutes at a time, several times a day. Step 4. Chiropractic care. If the pain persists, you may need to see a chiropractor. A chiropractor can perform manual adjustments to help alleviate pressure on the pinched nerve. Step 5. Medication. In some cases, over-the-counter pain medication can help relieve the pain associated with a pinched nerve. However, it is important to consult with a doctor before taking any medication. In conclusion, pinched nerves in the neck can be extremely painful and debilitating, but with the right treatment, they can be effectively managed. By identifying the problem, stretching, using heat or ice therapy, seeking chiropractic care, and possibly taking medication, you can successfully relieve your arm pain or rhomboid pain caused by a pinched nerve. Thank you for watching and stay healthy.